And today from Logan Health Women's, we have Women's Care. We've got the manager, Allie Wahl.
Hi.
Yeah, good morning, Allie.
Good morning.
And we have an RN with us, the incomparable Ashley Greene.
Hi, Ashley.
Hi, good morning.
Talk with us about Women's Care and why it kind of had to have its own department.
Yeah, well, we're half the population women, in
That's
a lot
true.
of ways. Yeah, I mean, the female reproductive system in itself is just pretty complex and makes a lot of sense for it to have its own department. Ashley, I want you to talk about kind of clinically why it's important.
Yeah, so we actually have 6 clinics total that fall under Allie here. We have OB services, which of course females are the ones that have the babies, so of course that's going to be the biggest thing. Then of course some of those services are going to be more complex, where we're going to have maternal fetal medicine. Less complex can see our midwives. And then we also have GYN, which of course is for our animals, to be able to get your PAPs done, get all of your screenings done that you need. And then we also have Gyn-Onc underneath us, which is for cancer care for different reproductive organ cancers. So,
Yeah, it's one of the things that strikes me here is that, most things guys just ignore. Women, you can't ignore. You can't ignore your reproductive system.
No.
You can't.
No, nor should any woman.
Of course.
Yeah. I
But
think
you really can't, because it's trouble.
it can be.
Big trouble, because, just the simple fact that it is so complex.
Yeah.
And it's just not something that I learned that with my daughter.
Mm-hmm.
And I had never experienced any of that before until she did.
Yep. It's not something you want to wait, the last minute to get taken care of. It's really good, especially I think for any woman, if you're able to get regular care. That's something that we try to help women achieve, is to get regular gynecologic care and then obstetrical care when that time comes as well.
yeah, just making sure that you have everything that you need. And again, those screenings are probably one of the most important things that you can do, because a lot of times, even whenever you end up with cancer or anything like that, you don't get symptoms until it's too late. So
Okay, so you don't wait for the symptoms. What is
No.
the frequency and type of tests that women should have done regularly?
yeah, so annual, you should have pelvic exams and breast exams. Breast exams especially because, for both, but breast exams especially just because it's the #1 cancer in women. And then, of course, with pelvic exams yearly, we're also checking for lumps and bumps because, of course, gynecology, oncology, cancers are the #2, with uterine being #2. And then, of course, it's it depends on if you have irregular PAPs or not. So if you have a regular PAP, you can go, up to 5 years without getting another one. Irregular history every 3 years. If you're having irregular PAPs, then every year.
Yeah.
This is a pap smear we're talking about.
Correct.
Yeah.
Yeah. See, women know this. Guys
Yeah.
don't. Paps.
You're like, hold on.
Yeah. In fact, most of us don't want to know
It's fair.
until we have to.
Yeah.
What are you looking for with a pap smear?
So they're actually looking for abnormal cells. So they actually utilize like a little brush and broom to actually scrape certain cells off of the cervix to check for cancerous or precancerous cells.
Literally a brush and a broom?
Yep.
Kind of looks like it, yeah.
That's what we call them.
Is that painful?
It can be uncomfortable, but if they do it right and you aren't having any abnormalities, it's usually just a little uncomfortable, and then
Okay, see, now
go about your day.
that's the first I've heard about that. I knew about the mammograms, which is
Yep.
kind of like a waffle iron or
Yeah.
something. Not pleasant either,
No.
right?
No.
It's not.
Aren't you glad you're women?
Yes, it's so fun. But I do think there's a lot of mystery around being a woman and taking care of yourself.
Yeah.
And so that being said, I think we like to be the people that women feel like they can come to at our clinic. to get the answers they need, to get their questions asked, because it's not easy and it's not clear to know what to do at all.
Wow. Well, let's kind of dive into some of that. Let's just say you're feeling healthy and everything's fine, but why do you need to show up? Well, we'll find out after this. And today wait a minute here. Today we're talking about women's health, and appropriately so. We're talking with Logan Health Women's Care Manager Allie Wahl and RN Ashley Greene. So I'm feeling healthy. I'm a woman, and I'm feeling healthy. What's to worry about?
A lot of things.
All right.
So, of course, we want you to come in for your screenings and make sure that you're staying healthy. That's going to be the most important part. But again, you come in and you haven't been in for 10 years, 15 years, you're having abnormal bleeding, things like that. Or you have nothing at all, but you come in and you have an abnormal screening. Now we're going to start worrying about precancer versus cancer. And we're going to have to start looking at more specialty care within the clinics.
Now, what about precancer? You've mentioned that. What is that anyway? I mean, it is just something that sometimes leads to cancer, or?
Yep. So it's abnormal cells. A lot of times it's caused by a virus that's called HPV. It's one of the things that they test with a pap smear. If you have abnormalities, then it usually reflexes, or we just go ahead and test you. And then if that comes back positive, then we do other procedures. I won't go into all of that, but that's a lot.
If it's precancerous, you do take steps to remediate and protect.
Put you on that track.
Yep. And there's certain treatments that we can do, versus birth control versus surgery versus just watching it, but it's still something that we want to keep a careful eye on.
One thing that caught me, it said if a woman hasn't been in 10 years, women actually let something like this go for 10 years?
Unfortunately, we live, fortunately and unfortunately. Fortunately, we live in a beautiful state where we can be out in the middle of the woods and live a great life, but also, unfortunately, we live in a very rural area where it's a little bit harder to get to services, or we don't understand the importance of getting in and getting those screenings done.
There's also a lot of, believe it or not, in 2026, stigma still around being a woman and going to the doctor at all, especially in the state we live in. Also, things like access to care, your ability to afford the services that you need, oftentimes will keep people from going at all for years and years and years. So, I mean, something that we want to make known to our community is even if, you feel like you can't afford it, we'll find a way.
Okay, now, John mentioned that guys kind of put off doing things, and we do it because, I don't feel good, but I'll check tomorrow. I may be feeling better tomorrow. Do women go through that too?
Sure, yeah, I think it's human nature.
But I know my wife is a lot more prone to go to the doctor and have a checkup than I am.
Well, we are smarter too. So.
That explains it.
Yeah, she got you, Robin. This is a fascinating conversation. I think back to my mother. My mother grew up in Florida, Tampa, Florida, moved to here in 1945, married my dad, had never been to a doctor her entire life. And so she's starting to feel kind of funny in the morning, and so she goes to old Dr. Malcolm Burns, and he says, "You're pregnant." She says, "I am not." He says, "Well, why wouldn't you be?" And that caught her.
Yep.
But that was the first time in her life at age 32 she had she been to the doctor.
Yep.
And that was the way it was back then.
Yep.
And
was that you, John?
That
causing
was me.
Problems?
That was me. Yeah. But the interesting thing is later in life, when they turned 65 and got onto Medicare, they got into a program, and it was almost like your car in your warranty program. And as a result, my folks lived to be into their 90s.
Amazing.
And when you when you consider what we had versus what we have, it's, there aren't too many reasons to
not
ignore
go.
your health.
Yeah.
And I don't think Mom ignored it. They just didn't do it back
Well,
then.
it wasn't the norm. I mean, back in that time, you went to the doctor if you were sick. And if you were sick, it was you were visibly, physically ill. I think a lot of the thing that people, women often forget is that sometimes the scariest things that could happen are invisible and they're quiet.
Yep.
And that you don't see them for a really long time. And that's why preventative care is so important. And that's what we're able to do now that we weren't able to do, even 30, 40, 50, 60 years ago.
So, Allie, how did you come to this position?
Ooh, great question. So I am a lifelong Montanan. I'm very passionate about healthcare. I am a 2-time cancer survivor, which has given me my own, special affinity for women's healthcare as a young woman. And I went off. I think I'm very passionate about clinicians and physicians need to be supported in order to actually support the health of a community. So I went and got my master's and came right back to Montana to get to work, and I've been here. Yeah.
Where'd you have to go to get the master's?
Oh, I went to North Carolina.
Well, all right. Why stick around?
Why? Yeah. But came right back. Yep.
Yeah. And Ashley, how about you?
I knew I wanted to be in healthcare actually since I was little. So actually through Girl Scouts. Welcome for that. Let everybody know. And then I've been a nurse for about 9 years now. And I actually, to be perfectly honest, I didn't want to go into women's health at all. I was like, oh, babies and moms. And I'm like, oh, that's scary. I don't want anything to do with it. And then I started kind of getting into it, and I've actually been doing women's health for over 6 years now. So I just realized the gaps that were there and the education that's needed for women, and I just want to be able to hold women's hands as they walk through different parts of their lives, whether it's good or scary. So.
Well, you mentioned earlier women who live in rural areas, and Robin will explore that concept with you after this.
We're talking with Logan Health Women's Care Manager Allie Wahl and registered nurse Ashley Greene. I don't know which of you I should address this to. Rural areas, how does women's care interface with that?
I think we're both pretty passionate about it being rural health. Me, of course, I'm a little more statistics clinical girl, but we're actually seeing a higher than average cancer rate in Montana now. For women, especially, we get like over 900, I think it's like 960 something women per year that are getting cancer now. Number one, of course, being breast cancer, like I was talking about earlier. And then next is gynecology, oncology, cancer diagnoses, uterine being the number one.
Now, is this an uptick in cancer in Montana among women?
It is rising, absolutely, yep. And we actually have an over the national average for ovarian cancer, which is not the most common type. It's actually a little bit more, the mortality rates aren't great with ovarian.
And we have no statistics why that is in Montana at this point, huh?
Not concretely, but I mean, we can think about why, and I think we can come to a pretty rational answer, right? If we think about our rural Montana communities, our rural Montana towns, these people have lived there for a really long time. Montanans love where they live and are really proud to live where they live, myself included. But let's think about like the lifestyle and experiences that most of our rural community members actually face on a day-to-day basis. Their economic status, their socioeconomics, the jobs that are available in the communities they live in, the distance from their community to a bigger regional healthcare center will kind of just naturally determine the level of care that individual is likely to receive or even to seek out.
So how can Logan Women's Care, healthcare, help?
Great question.
Okay.
So there's a couple of things that Logan Health Women's does. We do have one provider, and he'll go and do like outreach to some of the highline rural communities. So that's a program. We also, we're pulling patients right from Libby, from Eureka, from Browning, from Polson, from Lakeside, all of these areas. And so what we do when they get here is really try to accommodate them and keep them safe for the time they need to be in Kalispell or need to be with us in our facility.
Does telehealth play a part of this?
Yeah, absolutely. So not every kind of visit can be done via telehealth, but there's a lot of things that have changed in even the last couple of years that make it a lot easier to do a lot of them via telehealth and virtual. And whether that's you staying at home and your doctor's in the office, or your doctor is in another town and you are able to come into our facility and we get you connected that way. There's more than one option.
So it might be an initial contact. That way.
Oh, what about the outlying clinics, for example?
Yep.
Let's just say Shelby, for example. You've got a clinic there, but you probably don't have all those services there. Can you link up with somebody in your department?
Yeah. So I think something we'll do, like for Shelby, for example, is because they don't regularly have those services available there, we'll send one of our doctors there a certain number of times a month, right? And so the community members in Shelby and even then the surrounding area know when that happens, and they're able to get that care on a regular basis.
Do they have the equipment and the facilities there that they need?
Yep, they do. Yep, they just usually just need the doctor.
Oh, okay.
Good.
You just need the doctor and a pair of educated eyes.
That's right.
Yeah. What about communities like, I'm thinking along the High Line, for example, Chester and Rudyard and some of those communities.
Yeah, so again, we have those people that do go out that way, but if there's any specialty care issues that they're having, if there's any financial issues, things like that, we actually do have our own case management that works in our office. And so we can help with those kinds of things to get you here for more specialty care.
And you've got a program up there called Save Assista, which I think is just fantastic. Yeah, just make sure that there is no reason why a woman, for financial reasons, would not get a mammogram.
Absolutely.
Yeah.
Yep.
Now, women listening this morning who maybe have gone 10 years or something, how do they connect with Logan Health Women's Health Services?
Yeah, call our office is probably step one.
Do you need to be referred by your primary?
Nope.
You do not. Not for women's health. No, you just call us right up.
Okay. All right.
Yep.
Yeah.
Well, that's the shortest distance between
Pretty much.
getting caught up. So
Yeah.
that's great.
Well, Robin and I have learned a lot this morning about women's health and certainly the importance of it.
Yeah.
And we really do appreciate the work you're doing. And I hope that people in outlying areas and the ones that you're concerned about will go ahead and take the initiative and contact you guys.
Yeah, that'd be great. Thank you both so much.
Oh,
Yeah,
you're
thank
welcome.
you.